Hello and welcome to the review of the NCK examination. Today we shall be looking at paper 3, which was done in 2009. By today's standards, most of these questions will be found in paper 2, right? So let's get right into it. Question 1. The correct order of events of community diagnosis is... Alright, we know we have the 10 known steps in community diagnosis, starting with exploration of the community, right? That involves community inventory and contact with the community leaders. And you can see all the options have that as the first step, which is so great for us. Step number 2 is all about setting objectives. Then you do planning of the survey, you train the interviewers, and you pre-test the tools, then you sample, and then number 7 is execution of the survey, and that is data collection. And you can see option A and B, they have that as the correct step, right? So you can see here it's data collection is coming later here, right? So that means option A and B are mostly to be either one of them, which should be the correct answer. Step number 8 is all about report writing, where we have initial preliminary report before you give feedback to the community to get their input, right? Then from there you do the action, and then lastly you evaluate. So data collection here, we agree. Then from data collection, it's not feedback, it is report writing. From report writing, we go for feedback, then action, then lastly evaluation. All right, so that's why option B for boy is the best one here. Thank you so much. Let's look at question number 2, right? Question number 2. Characteristics of focused group discussions include... All right, we all know that focus group discussion, these are qualitative research designs. They are low-cost survey. Just use a trained moderator, and you could pick a group consisting of about 6 to 12 members, and this is more of homogeneous group. And of course, the discussion should take about 60 to 90 minutes, right? 60 to 90 minutes. So based on what we have here, you can be able to appreciate that, yeah, this one is talking about the participant between 6 and 12. That's okay, but it's not a quantitative. It is a qualitative study design, right? So this qualitative is okay, and the participants are homogeneous. This is still okay. I think that's what makes option B to be correct, right? Participants are not heterogeneous, right? They are used to collect information as a whole. Okay, the committee members 15 to 20 is too big. Homogeneous, yes, right? So option B is the most appropriate answer here. Number 3, after vaccinating a baby with BCG, right? Bacilline guerin for that BCG, that for the TB. A nurse should tell the mother to return the baby to the clinic if a scar does not appear after. Of course, averagely it should be like a month, so that should translate to around 4 weeks, right? Looking at our option, what is close to that is option number B, I think. And of course, it's generally between 4 to 6 weeks, where you tell the mother that they should be able to see a small scar or a lesion. Question number 4. Administration of tetanus toxoid (TT) vaccine to women of childbearing age should be... All right. Remember, TT vaccine to women of childbearing age should be like you get the first dose at first contact. Then first dose at first contact. I think I'm very happy that A is saying that, B is also saying that, Nurse C is also saying the same. Nurse D is also saying the same. Correct. Now, when do they get the second dose? That is 1 month after the first dose. 1 month after the first dose. So this one talks about second dose 6 weeks. Nope, this is not correct. So we can do away with this option now. Second dose 1 month after the first dose. Yeah, correct. This is correct. Second dose 4 months. 4 months? No. Maybe they could have talked of weeks, not months, right? Here it should be 1 month. So again, this option is wrong. This one, second dose after 1 year. Wrong, right? So actually, when just looking at the second dose, we are able to now agree to the right answer. Like the right answer is B, right? Because we all know that when administering tetanus toxoid, the first dose is given at when you have the first contact with the mother. Then the second dose should be given 1 month after the first dose. The third dose should be given 6 months after the second dose. The fourth dose should be given 1 year after the third dose. Also the same now for the fifth dose, you also give it 1 year after the fourth dose, right? So it is first contact, first month, 6 month, 1 year, 1 year. Okay, thank you so much. Question number 5. In primary healthcare, if you look at all this, and in primary healthcare, we always embrace community participation and need-based approach, right? Community participation and need-based approach. And that's why option A is the most appropriate one, right? We avoid things to do with donors. It has to be community oriented, right? The government is not the major player, it's the community that's the major player. Look, okay, community is the main player here, right? So that's why option A is the most appropriate one. Number 6, benefits of progestin only pills, POP pills, right? Like the denostrol, right? Denostrol. Looking at this option, it helps protect against endometrial cancer. Yeah, that one is correct. Decreases dysmenorrhea. Yeah, that is true. Family planning methods do not protect us against sexually transmitted unless you're talking of a backup plan like use of the condoms. The effectiveness is not affected. Pills are affected by other groups of drugs, right? So you can't rule out that. Cannot cause, it can cause, right? Okay, guys, so I think this is what made us to rule out this one, and the correct answer, the most appropriate answer is answer A. Number 7, a woman who has been on combined oral contraceptive pill for 2 years comes to the family planning clinic and reports to have missed one active pill. What should the nurse advise the mother to do? Stop taking, no, this should not be the case, right? Discard, no. Discard inactive, how do you know that, right? You should advise the mother to take the missed pill as soon as possible and continue taking the pills as usual, right? Okay. Number 8, sexually transmitted diseases that manifest with genital discharge include. Alright guys, we have those diseases that are present with discharge. So gonorrhea, urethritis, trichomonas, candidiasis, almost all of them present with discharges, right? What about option B? Candidiasis, correct. Urethritis, it's okay. Gonorrhea, it's okay. I think the problem here is herpes simplex, because herpes simplex is known to cause painful sores or ulcers and not discharge. C. Chancroid, candidiasis, trichomonas, chlamydia. I think we all know, like chancroid. Chancroid is associated with painful genital ulcers, right? So this one makes it wrong. We are not able to pick that one. D, we have lymphogranuloma venereum, urethritis, syphilis, and gonorrhea. Of course, syphilis, we know this one is normally associated with painless ulcers, right? So it's not a discharge here. And lymphogranuloma venereum, this one is normally associated with swollen lymph nodes. So that makes option A to be the most appropriate one. Next, according to the World Health Organization, WHO, clinical HIV staging infection, stage 3 in adults is characterized by, all right, the first option, weight loss of more than 50. Guys, this is extreme weight loss, all right, and it's not part of the staging. As for the cryptococcus and extrapulmonary tuberculosis, all these are advanced stages. So this is stage 4, right? Stage 4. And our question is asking about stage 3. Weight loss of more than 50, as we say, this is extreme weight loss and it's not classified, all right? So it will not be entertained there. Also, looking at this other one, HIV, encephalopathy, candidiasis of the esophagus, also again stage 4, right? Weight loss of less than 10%, right? 10% of usual body weight, respiratory infection, herpes zoster within the last 5 years. All right, if you try to look at that, weight loss then less than 10%, then recurrent respiratory infection. All right, recurrent respiratory infection is of more of a stage 3, but weight loss less than 10% along with herpes zoster, this appears in stage 2, right? Okay, so that makes this one is stage 3, this one is stage 2, right? And same to this one. Ladies and gentlemen, the most appropriate answer is D, which is talking about weight loss of more than 10% in stage 3. And then you have pulmonary tuberculosis and oral candidiasis, right? All right. Advantages of centralization. Centralization, guys. So centralization ensures that there is no duplication of efforts, right? Services are centralized together. This is correct, right? But high if cost of effectiveness, that's a disadvantage, right? It's a disadvantage. But the good thing is decisions are made quicker and faster, right? In that case, so this high cost of effectiveness becomes a problem. Also, freedom is very limited in this centralized manner, right? So this one, option B, is the most correct answer. Number 11, the correct order of steps in the disciplinary process includes, all right, so you need to have those preliminary investigation, which is okay. Preliminary investigation. You don't start discussing by the employer before you do the preliminary education, right? Investigation. So this one needs to be here, right? And this makes this option to be wrong. Discussion with the offender before the primary investigation. This makes it again this one wrong. Preliminary investigation. Yes, all right. You start with the preliminary investigations. Once you have the investigation, now you can discuss with the employee, right? You can discuss with the offender. So discussion with the offender, we agree with it. From preliminary, you have to discuss. You can't give a warning before you discuss, right? And that makes the answer here wrong. So you can see with the ruling out, we already have option A as the correct answer, where you are going to conduct preliminary investigation, followed by discussion with the offender, the strong verbal warning, written warning, and then lastly, suspension. Conditions screened for in a school health program include several things, and I think the most appropriate ones here is option A, which is talking about visual problems or disturbances along with anemia, right? Option B is wrong because of the typhoid. This is not part of the routine investigation. Same to the C, where all options are wrong. Option D, diabetes, is what makes it wrong, but visual disturbances should be assessed, screened. 13. Appropriate methods of dealing with occupational hazards include, all right, so we have ventilation of workrooms. That one, it's okay. Blowing dust away, this is ineffective, right? This is ineffective and this is not recommended, all right? So this makes this option to be wrong. Avoiding wetting substances that give off dust, avoiding, it's not possible, not practical, all right? Wearing protective clothes, carrying out machine in open space. All right, this one sounds like the best answer. We can keep it for consideration. D, carrying out machinery in open and avoiding blowing. This avoiding makes it ineffective. So option C is the best answer here. Number 14, a child's development may be indicated by, right. So when you talk about weight, this is about growth, all right, which may be indicated by the nutrients that maybe you're having. Tooth eruption, this demonstrates or shows both physical and developmental milestones, so it's the best answer here. Height is all about still about growth as well as some motor activities. The appropriate the approximate weight of a baby with a birth weight of 3.5 at 1 year should be, remember when looking at birth weight, it will double at 6 months, right? So this one should be 6 months, right? This is when the birth weight is doubling. But it should triple at 1 year, right? When you triple this, it should give you 10.5, all right? This is closer to this correct answer, right? So C is our best answer there. Advantages of home visiting include, well, when you carry out home visiting, it's going to help the nurse establish personal relationship with the family, and it provides the best option for the patients who are unwilling to travel to the hospital, right? That makes option D the most correct answer. The body mass index, the body mass index of a person with a weight of 60 kilograms and a height of 160 centimeters is, all right, that is just calculation, guys. You take the weight and you divide by the area, and that should give you 24.3, right? Waterborne diseases include hepatitis, amoebiasis, yeah, that's correct. Trachoma, cholera is there, but trachoma it's not. Schistosomiasis and trypanosomiasis. Trypanosomiasis, this is a vector-borne caused by the tsetse fly, so it's not included here. Scabies, this is a contact disease, right? Okay, and this one may be included. So option A is the best option here. For question 19, you indicate whether the statements are true or false. Number A is pellagra results from deficiency of niacin, right? Indeed, that option is correct because niacin is deficiency of vitamin B3, and it normally leads to deficiencies or symptoms that are characterized by the 3Ds, which is dermatitis, diarrhea, and dementia. Zinc enhances immunity, which is still true. So everything here is true, true, true. All right. For question number 20, you match the vectors in A with their corresponding associated diseases in B, right? So these lies are normally related to relapsing fever, right? Relapsing fever. And this relapsing fever, it can be either the LBRB or the TR, right? Or the tick, all right? Okay. Remember, onchocerciasis is caused by black flies, the simulin, while the yellow fever is caused by the Aedes aegypti, right? The mosquito, right? So tranquillosis, the one that is associated with cloves, and it normally is caused by Tranquillosis medensis, right? With an aid of a diagram, illustrate the life cycle of Ascaris lumbricoids. This is what you're supposed to do. Look at infection in eggs in feces, human ingestion, larva hatch in intestines, larva in migration, uh, lungs to migration to the lungs, and adult worm in the intestines. That's what you need to look at. State 4 objectives of occupational healthy and safety. They are several: compliance with legal standards, education and training, monitoring and early detection of health issues, adaptation to work to workers, prevention of occupational diseases and injuries, and promotion of and maintenance of workers' health. Outline three types of combined oral contraceptives and give two examples. Well, oral contraceptives combine the COX. We have the monophasic COX, biphasic COX, and the triphasic COX. Right? Four disasters that Kenya have faced and four roles of community health nurse in disaster management. We have several disasters like the COVID-19, the drought and famine, the flooding, the locust invasion. So as a nurse, you have to help in preparedness and planning, emergency response, health education and risk communication, post-disaster recovery and rehabilitation. Next, you need to explain three stages of purification of water on a large scale, right? This includes coagulation and flocculation, then go to sedimentation and then filtration. Number 6, you state 5 effects of protein energy malnutrition, PEM, in a child's body, right? They have several effects like growth retardation, muscle wasting, weakened immune system, edema, skin and hair changes, delayed cognitive development, fatigue and weakness, digestive issues, and anemia. Outline 5 phases of home visiting. Well, home visiting has 5 phases here. We have entry or initiation phase where you introduce the purpose of the visit and share relevant information, followed by pre-visit activities where you gather patient information and prepare for the patient. Then activities during home visiting. You establish rapport and trust and carry out planned healthcare activities. Then get to termination where you're going to conclude the visit once health goals are achieved or other circumstances necessitate the ending of that visit. Lastly, you have post-visit activities where you do document and report significant findings from the visit. Number 8, you outline 3 approaches that the nurse manager may use to prevent or control resistance to a change in an organization. So, as a nurse, in order to counter resistance, you have to carry out effective communication, also ensure that you are involving and all the members are participating, also educate and do some training so as to ensure that they are supporting you. LAQ this year, there is a case of poliomyelitis was reported to the Ministry of Public Health and Sanitation in Kenya, describe the pathophysiology of poliomyelitis, list clinical stages of poliomyelitis, and outline the control measures of poliomyelitis. Well, we have several. Polio is normally caused by poliovirus, which is normally transmitted via fecal oral route. This virus initially affects the oropharynx and the intestinal mucosa where it multiplies. So from here, it will enter the bloodstream leading to viremia. In most cases, the infection is asymptomatic or mild, but in small percentage, the virus can cross the blood-brain barrier and invade the CNS, particularly targeting motor neurons in the spinal and the brain stem. So the destruction of these neurons normally result in paralysis, muscle weakness, or in severe cases, respiratory failure. This disease progresses rapidly with symptoms emerging within the 7 to 21 days of exposure. So stages, we have incubation stage where there is no visible symptoms. Abortive stage, where there is minor illness like the mild flu-like symptoms. Non-paralytic stage, where we have muscle stiffness and pain and back and neck pain, but no paralysis. Then lastly, we have paralytic stage, where it's characterized by acute acid flaccid, right? Acute flaccid paralysis. How to have a control? You can do vaccination, where we have oral polio vaccine, which is given several dosages during national immunization campaign, or inactivated polio vaccine, which is normally administered as part of routine childhood vaccination programs to prevent polio. Apart from that, you could do surveillance, environmental monitoring, mass immunization campaigns, public awareness and education, improving sanitation, travel restriction, outbreak response, um, through mass vaccination campaigns, intensified surveillance. All right. Number two, you have the goal of the community health nurse in family is to help family reach and maintain its maximum health goal. So you are supposed to define characteristics or traits of a healthy family, give 5 principles of family health care, and describe the nursing process, right? So that's what has been involved here, right? Up to the end. And this is all about paper 2. Remember, paper 2, we are going to be looking at introduction to community health nursing, primary health nurse, and environmental health, communicable diseases, community health and community diagnosis, special health issues like family planning, we have home-based care, especially home visit, mental health and psychiatric nursing, sociology and anthropology, research in nursing, leadership and management, and teaching and learning methods. All right, God, that's marked the end of our review for the NCK paper. All right, please continue to share our videos so that we are able to get more audience for that particular interaction. Thank you so much.